I am delighted to welcome you to Providence Healthcare's first virtual Dialogue on Aging session in the 2020 series. Whether you're joining in person in the Lower Mainland or watching a recording, we are glad to be able to create this learning connection until we can meet again in person. This has been hard. This has been a long season of COVID and maneuvering through this pandemic. We have seen lives lost, we have seen unprecedented amounts of stress, and at the same time, we have seen resilience and opportunities. We have seen communities come together and break down barriers and break down silos that have traditionally been here. Our hope is that by bringing us together in this series, we connect once again our learning community of researchers, of clinicians, of keeners, of everyone who has that fire in them, who want to dream big and move our healthcare system in the direction it needs to be when we think about how we can truly care for our seniors, our most vulnerable populations in society, and actually revolutionize our healthcare system. The time is now, and I've enjoyed many opportunities with us over the years in our dialogue series. And what I've enjoyed most is thinking about the possibilities that come together when we hear each other, when we're inspired, when we take our learnings back, when we actually impact lives. And those possibilities, when I see the difference that each and every one of you are creating, is what is making the world of difference. While we have spent a lot of time on quality of care, our shift in attention in terms of focusing on people's quality of their life, of their lived experiences, is the direction that we are excited to move in. I want to thank the Alzheimer's Society of British Columbia as well, and our other partners in this series who have come together as exhibitors, who have pivoted to be here through technology. I hope you enjoy the session, and see you soon.
All right, so I'm now going to welcome Maria Howard, who's CEO of the Alzheimer's Society of British Columbia. Hi, Maria, welcome.
Good afternoon. It is a real pleasure to be here. On behalf of the Alzheimer's Society of BC, thank you so much to Providence Health for asking us to join again in another year of these series. There's such an important way to reach out into the community and talk about dementia. We know that in BC, over 70,000 people live with dementia, and that number continues to grow. And so the vision, the mission at the Alzheimer's Society of BC is to hopefully one day have a world without dementia. But until that day, we want to create what we would call a dementia-friendly province, a place where people living with dementia and their carers and their families feel included, they feel acknowledged, they have the quality of life that we all want. And there are 5 ways that really the society is focusing on doing that. And I think it fits very well with many of the conversations we've had through the series. We first want to change the conversation, which is exactly what the series is doing. We want to bring people together to talk about what it is like to live with dementia. There's so many elements of it, and we know that everyone has their own individual experience. And the more we talk about it and challenge those myths and accentuate some of the qualities that people learn while they live with the disease, the more we are going to ensure that people living with the dementia are feeling acknowledged and included. We want to change the experience. We want to ensure that people living with dementia and their carers and their families have the support they need. They have activities to go to, they have groups to talk with, they continue to be active and enjoy a quality of life and feel like they are a part of a community. We want to change the practice. We know that there are many professions, especially the healthcare sector, that are supporting people with dementia, and we want to ensure they have the right skills so that they can do their job and help people in the best way. but it goes beyond the healthcare system. It's the first responders, it's the buses, it's cities, it's even the airplanes, the airports. We need to ensure that people have the skills and the knowledge. We want to change policy. We need to ensure that the government and the legislation and policies that sit federally and provincially and at a municipal level support and reflect the needs of people living with dementia. And lastly, but absolutely not at the end of the list, is we want to change the future, which is research, which again connects us to our conversations here today. Research is so important in helping us look for that cause, look for that cure, or at least helping us figure out how we can live better with this disease. The Alzheimer's Society of BC plays a really critical role. We want to ensure that researchers have connections with people who have the lived experience so they can understand how their research should focus on priorities and really look at the things that people need. But we also need to ensure that researchers, what they are finding, their knowledge, their experience is getting translated down to people who are living and actually know what is the latest findings and some of the hopes that we are looking for in the near future. So it is so important to have these conversations, and it really makes me feel really honored to come here and be a part of the conversation with Providence Health, but also then to be able to turn and now introduce Dr. Lillian Hung. Lillian Hung is someone who is so near and dear to the Alzheimer's Society of BC. She is a researcher who completely understands the necessity of person-centered research, of including many people in the dialogue and taking the time to understand what is needed. Dr. Hung is the assistant professor at UBC School of Nursing, as well as she is the president of the BC Gerontological Association of Nursing. Much of her research focuses on technology. There is a number of projects she has had, such as the social robot, Paro, the iPad study, and one of my favorites, the silent disco headset. She has such a commitment to helping people live with dementia and understanding how technology can play a real significant role in that. Today, she's going to talk to us about living during COVID and how families and people living with dementia can continue to engage and connect, focusing on mental activity and building resilience. And she's also going to share a little bit about what may be coming on the horizon. So again, thank you so much for this wonderful afternoon. I'm glad you're all here. And Dr. Hung, over to you.
Thank you, Maria. And it's really my pleasure, and it's wonderful to see all the other presenters that presented. It's very, very interesting. So let me see, I could get my screen on here. So I hope you are seeing okay with the screen. So today I'm going to talk about three things. I'm going to talk a little bit about the existing technology that we have that everyone can use and they could get from the retail stores, and they could use it to stay connected with others. And I will also talk a little bit about some of the new robotics that emerge and how they are being used to battle with COVID. And in the end, then I'll share some of the practical tips and maybe a little bit of resources that everyone could try and use. Okay, let me see if I could go to the. All right. So I don't know, maybe we could try the chat box a little bit. And I am going to ask our audience to look at what maybe some of the technology that you use to support your health. When I say health, I mean your holistic health. That could be your physical health, your emotional health, and your social well-being as well. So you can, maybe we can type in the chat box and you can tell me, yes, you use this, or no, you don't use it. Does anyone use a smartphone?
We have a lot of hands coming in. I can see on my hand.
Okay, all right. Excellent. So you can just let me know. Yeah, I don't see that on my side. So what about do people use a smartwatch for their to track their exercise, like a Fitbit? Do we have anyone who said yes?
Oh, Yasuko, Carol, Agatha. A lot of people have their hands up still for that one.
Wonderful. And what about people use their phones to play games?
Lots coming up. Tony, Barbara, Ben, Amy, Kim, got a lot of people.
Excellent. What about movies? Do people use their phone to watch movies?
Emily, Ron, Kim, many more coming up as well here.
Fantastic. Ebooks, audiobooks?
Got about 10, 15 hands up for that one.
Wow, impressive. What about robot? Does anyone have a robot at home?
Some going down here.
All right, that's okay. Okay, so let me see. So I'm going to show you some of the devices that you can actually see in the market. So this can be quite familiar that if you go to Costco or go to Best Buy, you can see this Google Homes. You can see the price, they are quite reasonable. This one is $39. And Google Home has the voice command that people could use it. You can say, hey, Google, and okay, Google, you can ask the questions and it will answer you back. So it's interesting that you can see that we have a lot of misconceptions that in the society, people think that the older people that they do not use technology, but in fact, actually, when we just like hear it from you guys that you guys are, you know, saying that you are using some of the devices that I talked about, and when we look at the survey that was done, a lot of Canadian older adults actually have a strong interest, and they are using technology device as well. And some people, you know, used to think that, you know, older people cannot learn to use technology, or maybe because they have limitations that technology does not help them. The opposite actually is true, because these devices actually can compensate some of the limitations that older adults have in terms of, for example, like the voice commands and a voice over, and you can, with the phone, you can make the font bigger. So for this particular device, the Google Home, you can use your voice to make commands. You can ask questions to answer you back. You can ask Google, what is the weather, and it will tell you. And some people worry about, like, when you have a device like this too, you know, at home, they worry about privacy. And so we got, yes, that is true that we got to be careful about privacy. Maybe I will ask if anyone who would like to tell me if you have a Google Home at home, and if you can tell me about your experience about having it, or maybe some of the concerns that you have.
And you could put a message in the chat box too, and we can read it to Dr. Hung.
So you can see that the Google, behind this little device is a Google Assistant. Google Assistant is actually, it's powered by artificial intelligence, AI. So it's quite sophisticated. And I don't know, you know, that there's, at the back of the device, there's actually a button that you can disable the microphone. It's interesting when you have these devices that you bring it to your homes, it seems like very intimate, like sharing a technology that in your very private space, in your home or in your bedroom as well. But you do have the ability that if you want to turn off the microphone, yeah. So people did ask questions about, like, do devices like this record, you know, the conversation that you have? And I think Google did admit that it does record some of the recording, and they send it to language specialists to improve the services. So I would highly recommend not to say anything that's private if you have Google Home turned on. So this is another device. This is Echo, Alexa. So I think some people are more familiar with Alexa. The other one was Google Home, that was Google. And myself, personally, I use a Apple HomePod that I use Siri. So this one is Alexa. So there's three persons here. We have Google, we have Siri, and we have Alexa. Alexa probably is probably the most popular. This Alexa Echo here, it has a visual display, so it makes it a lot easier for people. I heard some of the family that said they have one for their loved one that they are living in the nursing home. It seems to be easier for them to use because of the display. And if they have Wi-Fi in the long-term care facilities, and they could actually use the Echo Show to do Skype as well. So that makes it a lot easier to take the call, and they don't have to rely on the staff to bring a iPad tablets to their room. They could just have this at the bedside. And I heard one of our gerontologists at our SFU, Gloria Gutman, that she was talking about she would do story time with grandma, with her grandchildren now. So something like this would be quite helpful if you have it for the grandkids, and the grandma can actually tell a bedtime story to their grandkids as well. So you can see there's a lot of possibility with these kind of devices. And again, if people are worrying about privacy, there's also a switch that you can turn off the mic and the camera. So when it's off, then then you can you can have your peace and quiet. Then if you don't want to be disturbed, so you also have that option as well. So you can use these to, when we talk about ebooks, you can use this to read. Some people like to read a little bit before they go to bed, or you can use it to read the books to you. You can use audio book as well. Wake up in the morning, you can have it to tell you about the weather. You can use it to set up your agenda in your calendar. And with my HomePod, sometimes I get up in the morning, I would ask Siri to tell me like what do I have in my agenda. So it's kind of interesting.
And Lillian, we have a question.
So this is yes.
The question is from Sharon, and she asks, do the various devices speak languages other than English?
Yes, they do speak other languages as well, but I don't know how many languages. They do speak French, and they do speak Chinese as well, yeah. But I'm not sure you can buy those that they speak other languages in here. But I know some of the devices that you have, like for example, like a computer, when I do set up, I could choose the language option. So I am not sure about each individual device, but I know some of the, like for example, like an iPad in the beginning, when you set up, then it will ask you to choose a language. Yeah.
Thank you.
All right, and here I have a Fitbit. On the pink one is a Fitbit. The white one is the Apple Watch. So these devices, they vary in terms of price, and the Fitbit has become very popular for people who love to track their exercise patterns and to develop, a healthy habit for their physical health and also mental health as well. People compete with each other and try to, exercise more. These Fitbit goes about $100 to $200, and on the other side, the Apple Watch, they are a little bit more money. They cost about $250 to $500, depends on the version that you have. They serve the same purpose. They track heart rate, and encourage you to exercise. You can play music, and of course, the Apple Watch can connect with your phone as well. Then you can use it to answer calls, and you can also send messages as well. And the new version that that came out last year, that here in Canada, we can actually have the version that will actually detect your EKG as well. And we have heard stories of people that they actually the EKG detection helps them save people's life, and when they alerted them when there's abnormal rhythms in the heart. And it also had the fall detection as well. And there was a story about a man who fell in the middle, really early in the morning, and he had no idea, and he went to the bathroom and he fell, and the Apple Watch called the emergency. Another story about a woman that thinks she had a car accident and she had a baby with her, and her phone got flew away, and but she had her Apple Watch with her, and she said, Siri, call 911, and the emergency vehicles came, and that saved her baby and her life as well. So interesting that we are getting more and more of these technology in our life and everyday life, and that seems to be quite important. Another thing got very, very popular. It's virtual care, and especially when the COVID hit, and the number of the visit of the virtual care just like skyrocket. And I have tried it myself, and it's very, very convenient, and I highly recommend. And it's very easy to use. If you go Google, you just Google online virtual clinic, and there are several different companies that you can choose, and it doesn't really matter because each of the company, when you register and when you need to see a physician, they normally will have a list of physicians that you can choose as well, and it depends on the time. And you don't have to go to the clinic. You don't have to worry about like waiting for a few days or maybe a couple of weeks trying to get a physician, or you have to wait in the clinic to worry about that you might get connected with another virus or something. And so it's very, very helpful, and usually within a very short time then you get to see a physician, and you talk to the physician by either using your phone or using a computer. And you can also talk to other professionals as well. You can connect with a social worker, you can talk to a psychologist, you can talk to a counselor. And when there's a prescription or there's a referral for some blood work or seeing another specialist, and they could directly send you over there. And for me, that when I used at that time, and when I register, I enter the pharmacy that I used. After I finished the visit, I just went downstairs and I picked up my prescription. So it's very, very easy. So now I am going to talk about the device that we use in VGH. So we also provide virtual care in Vancouver General Hospital where I work. And this is essentially this is an iPad that has a mechanical arm behind it, and a stand with 1, 2, 3, 4, 5, the 5 wheels there. So we can actually roll the iPad to the patient. You can see the one photograph there that we have a family here and a nurse and a patient there. So the family was talking to the patient, and the patient, he was actively dying at that time. So with the lockdown and restriction with the visitors, and so it makes it really hard for family to come in to see the person, even though we have compassionate care that the family are allowed to come in if it's end of life, and but it's limited, right? So with the iPad available, so a family could call in and they could spend longer time with the person. And this person has passed away, and we felt really honored that we were able to using the iPad and help him connect with his family. So it's menu, you can see. So I'm going to show you another iPad on wheel. It's on 1 wheel, not 5 wheels, and it's instead of having it manually that we roll it around, this one you can actually remotely control it. So I'm going to ask maybe Christine or Megan to help me to play the video of this iPad on 1 wheel. It's called Double. Yeah.
And just while we flip that over to you, I see Cynthia has a question. So Cynthia, I've unmuted your mic.
Hi, I was trying to get into a chat, but I was just wondering if she has a GPS locator that she could recommend with technology.
Oh yes, they are actually. You can get them from Costco. They're very reasonable. They're not expensive at all. They're just like a little sticker. Then yes, you can use that. Yeah.
Okay, thank you.
Yeah. Yeah, I know that you can use it for many purposes, and it does help. To help to find things or help. Yeah. Okay, so we're gonna look at this new robot. It's called Devil. So the video is gonna show you about this robot used in education, how a specialist or a professor can be in the classroom with clinicians to teach them about techniques. And I'm going to tell you a little bit, like just watch the video first, and then we'll talk a little bit about how my plan to use this telepresence robot in a different way in a clinical setting.
Even though we have this distributed learning model and we have different campuses, we really want to ensure that regardless of what campus you go to, you have the same learning experience.
The physical therapy program is a 2-year master's degree, and we operate on 3 separate campuses. So our main campus is in Edmonton. We have 2 satellite campuses. One campus is in Camrose, which is about an hour southeast of here. And the other campus is in downtown Calgary, which is a large metropolitan city.
Courses can be delivered from any campus. Most of the instruction happens from Edmonton, but all of our professors that are at the satellite campuses teach 1 or 2 courses a year as well.
We've done some evaluation of our satellite campuses, and one of the themes that we heard from some of the students is that they don't always feel connected to the main campus. So we thought that using the double robots would be a good way we could try and bridge that gap, in addition to what we have using the video conferencing or the Skype or Google Hangouts. This is maybe a little bit more of a personal connection to the students.
You can connect with a student on a laptop, but with a double I can actually connect and also still look around the room. I'll dial into Edmonton, pull a student aside and do a quick skill check and see how they're doing.
So we usually use the double for labs when the professor's not here in Camrose, or for group sessions. So we have a lot of seminar groups. Professors like to encourage discussion about different topics, and lots of times they'll come in on the robot just to kind of chime in, see where everyone is and how discussion is going.
I found it really helpful to have them involved in the assessments because I was able to get feedback right away, and I knew that it was what the prof wanted, and I felt comfortable doing the skill because he was able to adjust the screen and see what my hands were doing. I thought that it was really effective.
It's really an intuitive system. We didn't really need any of our IT professionals to help us, and once we sort of showed the professors how to use it, it's really just 4 or 6 different keys on a keyboard to control it, and they found it pretty easy and pretty intuitive.
In the faculty we have different levels of comfort with technology. That's not really an issue, it's pretty straightforward.
But I've actually honestly noticed that it does feel more personal. You know, we can move cameras with video conferencing and stuff, but you're still talking to a TV, and yes, you're talking to an iPad, but the iPad's moving with you, and so I think that it does give that more real-life interaction with the students.
I think the robot allows the professors to be more one-on-one with the students, but in a mobile environment. A lot of our students are working at different plinths, practicing their skills in a lab. Using the double allows the professor to autonomously move around between the different students, check in, and then move on to a different group.
The big benefit for us, because we are such a hands-on profession, and a lot of the learning is done in a hands-on environment, that you have the versatility of moving that camera around and moving the double around at another site.
I mean, the thought that we actually run a physiotherapy program via the internet is crazy with how much hands-on things that we do. So using the double is just another part of our mission to try to make it feel to the students like you truly are in the same room, and to deliver quality physical therapy education without having to go to the city or to that other campus.
All right, so you can see that I used my cursor a little bit to try to help you to find that double. And the double is actually, essentially it's an iPad that, okay, let me see. It's an iPad and on the stick, and I have one wheel. And what makes it unique is that you can actually remotely control to make the iPad goes up and down, or tilt it or move around in the room, and makes it go to a place that you want it to go to by remotely control by using a phone or a computer. So so I'm thinking about, you know, getting the robot to use in a long-term care or in a hospital setting. Then we can actually, when we have someone who is in isolation, and maybe they are under quarantine for 14 days, we could actually have the double robot in the room. The family could actually remotely connect.
This is a different.
We could also have physicians to do, if the physician needs to go to see the patient, instead of putting on the PPE and taking the PPE off, we can actually use the robot to have the physicians to talk to the patients or the residents. So there's a lot of possibility, and it can be used in an education institution like university for professor to talk to the student to teach them about, you know, clinical techniques. But we could also use it in a clinical setting to do virtual care to help connect with patients and family. family could also have remote control, and bringing the robot closer to the resident, so they could have a better look of the person, and they could also move the robot around a little bit, and it's a different way to engage. And yeah, so maybe I'll wait for a little bit and see anyone who has questions, or if you think this thing is possible, or if you have any concern you don't think this should be used.
Or sorry, Chi Ying.
Thank you. This is Chi Ying. For those seniors living alone, of course, I don't know how this double robot costs, how much it costs, but it would be a good idea to find the seniors in the area or so. Would you recommend that? How the seniors would use when this going around to checking?
Yes, actually, this is quite reasonable. It's $2,500 US. It's in California. The company is based in Silicon Valley. You can order it. It's commercially available. And I have heard about older people that use it, and some people take it with them to travel, and they put it, like when they travel to different countries, they will take it with them. You can do that, and it comes with a travel pack as well. But there are people that they're like grandparents. So the children, adult children, or grandkids want to talk to their grandparents, and they will leave a robot in that house, and they could they could remotely bring that robot to the grandma and go talk to the grandma. Or father wanted to talk to their kids, and they're working in different countries, and they could have that robot in the house, so you could move the robot around the breakfast table and talking to the children as well.
Thank you.
Back to you, Lillian.
Okay, so I'm going to talk about a different type of robot here, a nursing assistant. Okay, let me see if I could find it. This is Moxie, so I'm gonna see I could bring Moxie here.
Moxie is a teammate. She's here to actually relieve some of the pressure of task and the hunt and gather that we all have to do all day that takes our time away from the patient.
Diligent Robotics of Austin designed Moxie to perform routine tasks in a clinical setting.
We really need to understand the workflows of these units. We need to understand, well, what do nurses do? How do they do it? And how do we think about Moxie fitting into those workflows?
Her little voice, you know, when she passes you and says hello, and her eyes, she does seem to have a personality. We don't think of her as a thing, it's Moxie.
During a month-long pilot, Moxie stocked patient rooms, removed dirty linens, and took samples to the lab.
Almost 30% of our task during our shift is to fetch things. If you're in the patient room doing something, oh, okay, they need an extra blanket, it's not there, you need to step up. But at this time, all you need to do is press your voice-over button, call for Moxie team. It responds.
So we anticipate that this will give us better insight into a couple of things: how nurses feel that they spend their time in a given shift, but also what time we could give back to our patients. So how this could potentially impact patient satisfaction, patient outcomes, and the overall experience within the hospital.
Patients are intrigued by Moxie.
They have seen at the door side, they will ask us, hey, what is that? Is that a robot? It's really funny and interesting the way how they look at it, but they are also happy that we are working with it.
So it's been really amazing to look at what we're doing here in the very first phase, very first hospital deployment of a care assistive robot, and what the future could hold. Because just the impact that we've seen for our team within this last month, it's amazing what we could potentially give to healthcare in the future.
She's really created with my team a sense of unity as we look at, oh, what can Moxie do for us?
All right, so I am gonna open, and I want to ask the audience, do you think something like this that roams around in the hospital, do you think something like this, Moxie, should be used in the hospital or in our long-term care? Is it acceptable to you? You can, raise your hand to say yes, or you can say no, and just let me know what your thoughts.
We have a lot of hands going up.
Oh, excellent. So let me see. I'm going to go back to the main screen. All right. So this is another telepresence robot. It's her name, or his name is Tammy.
Hard by this virus, and to curb its spread, they have banned visitors and put into place strict protocols. But now one local nursing home using a first-of-its-kind technology to add to its toolbox to protect residents and staff. 7 on Your Side investigator Dan Grout with more.
Like most nursing homes in our area, Andress Hudson in Westchester has had seniors come down with and pass away of COVID-19. They launched a new way of helping to treat patients. A nurse or doctor on wheels.
I think it's going to become much more widespread and used.
A robot that rolls into patients' rooms. A doctor or nurse is behind the controls. Their face shows up on the robot's computer screen. But it cuts down on physical touching in critical situations. It can check breathing, blood pressure, you name it.
It's really a win-win. Doesn't substitute the human connection and the human touch by any means. It really is an extension of it.
It also cuts down the amount of personal protection equipment that we've heard so much about. Equipment that has been rationed.
So there we go, because now it knows you're turning.
The robot learns as it goes. And so are the residents.
We've had people that were at first were like, what is this coming in my room? What is that? And then they've gotten used to it.
The new technology is something residents will have to get used to at many assisted living facilities across the area. The robots can be used during non-pandemic times when a doctor isn't in the building.
It is the future. It's new.
Miles Brown is in the business of designing senior centers. When this one is renovated, he's working on a plan to include contactless technology wherever possible, not just robots.
To incorporate technology such as hands-free doors, faucets, plumbing fixtures that just obviously, for obvious reasons, don't allow as much transmission of bacteria.
The technology is expensive, but can cut down on transmission, and says it's something nursing homes in the future will be considering when it comes time to renovate or update their facilities.
I see it becoming much more widespread. And in our industry, that would be, I think, a great thing.
During the pandemic, there has been more flexibility from Medicare and Medicaid for telemedicine, so we will be seeing more of it in nursing homes moving forward, if not through robotics, then with other electronic devices.
Here we go. Yeah. And I find it also very interesting that the other residents are wearing a mask. They're very good.
This robot assists the elderly without the risk of being infected with the coronavirus. It's called Tammy. The elderly are more vulnerable to the virus, so some retirement homes have taken measures. Tammy is an assisted technological solution helping the elderly and relieving the work of healthcare personnel. The robot also helps to preserve the health of seniors as much as possible while remaining close to their families through video calls.
Due to the recent outbreak, we've banned families from visiting our nursing home since the beginning of the Lunar New Year. But of course, our elderly residents would feel depressed when they can't meet their families. With the help of these robots, they can make video calls so families can still communicate with the elderly face-to-face without being physically present.
The outbreak of COVID-19 has caused a lot of disruption to daily life in Hong Kong. Many schools have been closed and people were advised to avoid social activities. But thanks to this robot, some families feel reassured.
The senior center bought a robot so I can meet my mom. Sometimes I notice that she forgot to put on her dentures. I can immediately ask the nurses to remind her. It's easier when we can see each other, but just calling on the phone may not be so accurate. But when I see her, it's safer to know that she's okay.
Invented by a company in Tel Aviv, Israel, Tammy can remind residents to perform their daily tasks, such as washing their hands and exercising, thanks to its voice guidance function.
All right, so I find it's interesting. It's the same robot used in 2 different countries. One is used in New York, and in United States, and this video just showed that it's in China. So questions? Do you? Well, first of all, I pose the questions to everyone that do you think that a robot like Tammy that should be used here in our country here in Canada or in the hospital and long-term care setting?
And we've got hands going up.
Fantastic.
And Lillian, we did also have a comment saying this is a great use of technology. So
wonderful. So I might also want people to think about like what might be some of the concerns by having a robot like this in a care setting. If you're with the families, or if you're you're a nurse, and would you have any concerns about having something like that in a care setting? Another thing maybe to think about, like sometimes it's not so easy to implement a technology. If you can think of there's anything that could be a barrier, or what we can do actually to maximize the potential about using technology, because sometimes people have different feelings and perspective of worrying about, they may have concern about the risk and about using the robot. So I would love to hear, your thoughts and your perspectives as well. So we're here learning together, and I'd love to learn from you as well. So you can either post that in the chat box, or you can raise your hand and tell me. Yeah.
So we have one comment here. Would just not want it to be hacked and perhaps access medical records inappropriately. Also, how to keep it clean.
Right. Those are very good thoughts. Yeah. To make sure that it won't be hacked, and that's the privacy. It's very, very important. And cleaning is also can be a concern. And but these things are mostly made of plastic, so we can easily wipe it down with the SL or those anti bacterial and antivirus wipes that we normally would use in the hospital. So that is very doable as well. And the good thing actually about the robot is that the virus will infect human, but it would not infect the robot. So we just need to clean it between patient use. Yeah. And actually could provide some safety. And like what the video talked about, that it could also conserve the PPE use as well. So this is the last robot that I want to show you. This is Pepper. Some of you might have seen it on, let me see. Pepper, we have Pepper here in Canada. This video will show you Pepper being used in Humber River Hospital in Toronto.
All my lonely days are over, and my nights are filled with joy. All those lonely days have gone away, and my heart's like a little toy. With my lonely days behind me, I can taste the sweeter things. I can drink the wine so cheap and fine. I got the world hanging on a string. But I know you never, no, you never leave me stranded or do me wrong. 'Cause those lonely nights have gone from sight, and together we belong. Lonely days won't be coming back. Goodbye, love.
So Pepper is a little bit different than the other telepresence robot that I have shown you. You can see Pepper has arms and eyes. So these kind of robot, we call it humanoid robot. It looks like it has the features like a human. So again, I want to ask that question again to see would that be, with something like Pepper, would that be acceptable to have it in our hospital or long-term care setting? What do people think?
We do have a lot of hands coming up.
So that means yes, people are okay with having Pepper around.
Yes, we've got some yeses in the chat box. And we do also have a question or a comment for you. And it says, if a family member was allowed to use the iPad at the care home for 10 minutes per week, this might lead to actually isolating the patient because they no longer see their family except for 10 minutes.
Yeah, so you see, so I highly recommend it, like those other devices like the Echo box that I show you. You can, I see that will be a game changer in the future when we have that at the bedside, and you won't need to rely on the staff to bring the iPad to the bedside and only the 10 minutes a week, right? So you can actually talk to your loved one anytime you want. Yeah.
Yes, brilliant, especially at Children's Hospital. And another that says, I think it would be great in seniors care to provide additional support, social support.
Yeah, Pepper actually has been used in Japan to help people to do cognitive exercise, stimulation exercise. And actually both cognitive exercise, they play games together, and they also do physical exercise together as well. And Pepper has his move, he knows how to dance as well. And we do have peppers here in SFU in the Rosie Lab. We have 4 peppers here, so that's I think you will see peppers being around in the coming years more and more. Yeah. Okay, so those the robot I wanted to show you. So I'm gonna end my presentation with just a few tips. So maybe before I go to that, like how all of you are doing? Are you doing okay with physical distancing? Well, we have to emphasize physical distancing. Does not mean social isolation. You can still stay connected by using many creative ways. I mean, I talk about the technology from very high tech to very easy to use, very accessible from high price to low price, and but we all have very simple technology, just even a landline, a phone that we can pick up and call each other. So there are many possibilities. So just a few tips here to make sure during this time to make sure you protect yourself. Making sure, I hear a lot of people are having a lot of anxiety about the uncertainty. So making sure that you have plenty of rest and and try to have healthy activities, which I will talk a little bit about that in a minute. And give yourself permission. It's okay to feel stressed and nervous. I think a lot of us, doesn't matter that where you work or where you live, we all collectively feel nervous with this virus because it has done a lot of harm and caused a lot of stress and human losses as well. So it's okay to feel stressed, but together we're grieving it collectively, but together we can get through it. It's very important to maintain a routine, and if research tells us that with social isolation, people could easily have a cognitive decline and physical decline as well. So by maintaining a routine, you have time to go for a walk and do your reading, and make sure that you maintain your function abilities. That is very important. And the social aspects, and talked about, just pick up a phone, call your friend, support your friend, and support if you know there's a neighbor and someone who is living alone, make sure you give the person a call. So it's very easy during this time that people are so focused on infection control and only focusing on the physical aspect. But it's also very extremely important that we think about our mental health and our psychological well-being as well. I can't emphasize enough about that. Healthy activities. The weather is getting nice. People could go outside to do their gardening, go for walks, and in the hospital that we've been doing some virtual cycling. What we did is we use iPad. We project an image on the wall. We have a few patients that sit around in in a circular shape and remain physical distancing. But so they will have a bike in front of the wheelchair, and they will cycle. And then we use YouTube to play a video. This particular video, it's Stanley Park, so we'll bike around Stanley Park together. So it's kind of fun. So it's just an idea if anyone who would like to do that as well. And you don't have to do it with a group. You can easily do it at home. I have a small bike that I buy from Amazon. It's $49. It's just a small bike under the desk, and it's half bike with the pedal. So I pedal that, and I could turn on the computer. I could have music on, and I could go find a bicycle tour anywhere in the world. I could go to France. I could go to Rome. I could go to anywhere. It's kind of fun as well. So an idea you may want to try. Games, and some people think games is only for young people. It's certainly not. And I heard from you as well that some of you play games. So there's lots of apps. They are freely available that you can use on your tablets or on your phone. And this is a website here. It's called actodementia.com, and they have collated games that they find that it's they're not then. So you don't have to compete with the time. So they make it a little bit more user-friendly for the people with dementia or with cognitive impairment to use. So you can play it single, or you can play with families with a younger person as well. So yeah, it's carefully, thoughtfully designed. And if you're looking for a game for a family member who might have like early cognitive impairment, mild cognitive impairment, MCI, and this might be something that you might want to try. Or I have seen in the hospital, I've seen people with even moderate dementia that they play the mahjong game as well. If they have played the games all the way along, and they, just with the habit memory, and they know how to play as well. So it's a really good way to have some fun. So this is my last slide, and I'm gonna take you to this is a booklet that if you would like to have, and I'm sure Christine could send it to your ways. And there's a lot of resources in the book. It's made in UK, and if you go to the book, and if you're looking for activities, if you're a recreation person that you want to plan some kind of activities for nursing home, there's a lot of resources here. If you're looking for something that for yourself to do, if you want to go to a museum, online museum, or you're looking for a game to play, a way to host a party, and all kinds of really wonderful things. And you can host a concert and soothe. You just maybe show you can also go to a zoo online, and you can have actually see live cameras to see what the animals are doing in the San Diego Zoo. Let me see. Let me close this one. Yeah, so it's and you can also see videos, and it's very, very interesting. Yeah, right. I don't know. Let me see. I could show you this one. All right. So I think that's all the time that I have, and I am happy to answer any questions.
Thanks, Lillian. That was such a great presentation, and I can honestly say I have never watched a presentation on technology before that's included a video on a baby hippo. So I think that's why I really appreciate listening to you, because sometimes talking about technology can be intimidating for people. Sometimes people don't think it has too many uses, but you always come and show the diversity of it, and how technology can be used to help us have a better quality of life rather than technology directing what we do. So it's just a fascinating topic. So thank you. We do have a little bit of time for questions. I encourage people to either use the chat or to click the little button on the right of your screen for raising your hand. Please remember that the session is recorded, but just welcome any questions that you might have for Lillian at this time.
We have Chi-Ying. I'm going to unmute you. There you go.
The question is about using those devices with people having Alzheimer or yeah, those kind of or dementia in general, or some specific. Is there anything we need to be cautious about?
Yeah, and I think it's very there's a misconception out there to think like people with Alzheimer's and dementia, they're all the same. And actually it's a very heterogeneous group, and like people can range from very techno savvy to people that they do not like to use technology at all. That some people will absolutely refuse to use it, and some people are very keen. You know, patient partners like Jim, that he works with me, that he's on Twitter, very good and very savvy, and like lots of people wear a smartwatch to track their health data, and it's just really a wide variety. And I would say if for my own family or for myself, the early that you introduce the technology to the person, then you have a better chance to have that person to learn more and get used to the technology, and it will be very helpful.
Any other questions?
Just having a look here. I'm not seeing anything else pop up. Any last questions there if you want to pop your hand up? It looks like I'm hearing a comment that was excellent and exciting. So it looks like people are wrapping up.
Well, thank you so much, Lillian, for your presentation today. I think it was also really helpful to have your questions throughout the presentation. I think people appreciate being able to ask you questions while you're on the topics, and you're also very interactive. So that's been a great way to spend a Thursday afternoon. And I thank you all for joining today, the first virtual dialogue on aging series by Providence Health. Very exciting, and we invite you to join us again for the second series. It will be on June 11th, and Dr. Eli Putterman is going to come and speak to us on moving more in COVID-19. The Alzheimer's Society BC is so pleased to sponsor and partner with Providence Health on this series, and it really is a way to change the conversation and support such a necessary focus on helping build a dementia-friendly BC and changing the conversation to support people living with dementia. So again, thank you for joining us. And in the words of Dr. Bonnie Henry that we have heard so often but are so important, be kind, be calm, and be safe. Have a good afternoon. Bye-bye.
Thank you. Lillian, can you stay on for one moment? There is one more question. And to anyone else who wants to leave the call now, thank you. And Lillian is happy to answer this last question. Can you talk about the bike a little bit more?
The bike? Yes.
Bike? Yeah.
So in the hospital, when I work with the patients, that we have the high-end medical device, that type of bike, it's called active passive activator. So those, the price range to over $1,000, but it has you can, if the person who their legs are very weak, you can have it passive. The person could just put their leg on it, and you can put the motor on, and actually can motor, give you a little bit of help and try to help you to gain the strength. And if as you have your legs getting a little bit stronger, then you can take the active role, and then you can actually increase the resistance. So those bikes, the high-end bike, could do a lot of things. And but what I use at home for myself, it's a lower end, a very economical bike. If people who are living in the community looking for something that's easy to use, and you can actually could find it from I think if you search like desktop bike or exercise bike, and you can find them. There are essentially there are just like a bike with the pedal, so no top, just the pedal. So I put it under my desk, and I blast the music and I go find, a video that I want to watch anywhere in the world. So I watch the video, makes me feel that gives me the immersive experience that feels like I'm riding in France, and I have the music on and have a great time.
All right. Other than that, I'm just seeing some thank yous for an excellent presentation. So thanks for staying a few extra minutes there, Lillian. And we'll look forward to seeing everyone on June the 11th. And we've got lots of thank yous coming in. All right.
Thank you. All right. Thank you.
Bye, everyone.